Okay. Well, who is having the exam soon?
On 20th.
Dr. May, yeah. Anyone else? Anyone else is giving the exam in 2 weeks or less than, or in 3 weeks?
Hello, doctor. I have exam in 12th of December, near 3 weeks.
12th of December. Yeah, less than month, right?
Yeah,
That's good. So, how do you feel, Dr. May? Your name, what's your name, darling?
Atusa.
Atusa. All right. So, how do you feel, Dr. May and Dr. Atusa, about reaching the exam?
Very nervous.
Yeah.
Very nervous.
Yeah, it's normal. It's normal. It's normal to have this nervousness for the exam. Just try to cope with it. It's unavoidable, all right? But try to think that, okay, I'm reaching my exam, I'm going to finish all of this suffering, inshallah. I'm going to pass, I'm going to do my best in the exam, and inshallah I will pass, all right? So try to bring the positive thoughts instead of just bringing the negative thoughts, all right? Focus on how you manage your stress by, relaxation techniques, breathing, okay, thinking, kind of meditation before you sleep. All of these are helpful, to be honest, okay? Some exercises in the morning, you need some endorphin, so it will really help, okay? And something else, if you feel someone is trying to make you nervous or trying to talk about the exam in a negative way, don't listen to them. Okay? The exam is doable. You can do it. Hundreds of people did it, and many of them did it without any academy, did it by themselves, without any courses. So it is doable. Okay? Just believe in yourself, trust yourself, go to the exam with all confidence. You will do it. All right? Okay, let's get started. We have 4 cases for today. Okay.
Begin.
Hello, examiner. I'm Atusa Bosogia. My GMC number 123. May I proceed?
Yes.
Yes. Hello, I'm Atusa, one of the doctors. Are you Mrs. Maria Armstrong?
Yes, doctor. Yes.
Nice to meet you. Can I call you Mary?
Yes, Mary is fine. Yeah.
Thank you. Could you please confirm your age before we proceed?
I'm 45 years old.
Thank you. So, Mary, I understand you've done a test, and after that, another test to confirming the diagnosis. Am I right?
Yes.
Can I explain why you did the test?
Well, it's with just, routine checkup on myself. I'm conscious about my health. That's why I went to the well woman checkup to find out if I do have a problem, just, for screening. Yeah.
Okay, that's a good decision. But after that, we've done another test. Do you know why?
They told me I have a problem in my blood count, I think, and they wanted to check
Okay,
the
okay.
iron level. Yeah.
Mm-hmm, mm-hmm. What do
Yeah.
you know about blood counts and iron levels and the problems with them?
They explained to me, but I was not, you know, paying attention to what was the problem exactly.
Can I ask you why?
Just they were talking quickly, so I didn't get what they meant by what's going on.
Oh,
Yeah.
oh, okay, okay. I'm really sorry that happened, but I try my best to explain all the details very
Okay.
slowly. And if you have any questions in between, I can also come back and maybe review that again. What do you
Okay.
think?
Yeah, it's okay. Yeah.
Okay, okay. Can I ask you some questions about your symptoms, well-being?
Well, I'm well. I don't have any symptoms.
Okay, I want specifically ask about any breathing problem,
No,
any maybe chest pain or pain anywhere else.
no,
Okay, and any bruise or any bleeding.
no,
Okay, thank you. So, Mary, can I ask you, have you been diagnosed with any medical condition before?
no, doctor. I do not have any problem.
Okay, do you use any medication on regular basis?
No,
Any allergy?
no,
Do you smoke?
no, I don't smoke, doctor. No,
What about
no,
alcohol?
just very occasionally. Yeah.
Okay, okay. Thank you. And about your living, can I ask you, who do you live with?
I'm living with my wife.
Okay. And your wife is supporting?
Yes.
Okay. Any problem at home?
No.
Any other one, any friends or other family members helping you with things?
Um, I'm managing well, doctor. Yeah.
Really good to hear that. And about your family, are they living near you?
Excuse me?
About your family, any disease runs in your family, any blood disease?
Uh, well, my sister has thalassemia.
Okay, okay. So do you know about this disease?
Not really. They told her that this is a blood disease, but I don't live with her, so I don't know what's the problem exactly.
Okay, okay. Is she doing well now?
Yes, she's okay. Yeah.
Okay, okay. And do you have any special question about the lab tests?
No.
Okay, so now I'm gonna explain you what we've done. At the first time, uh, we check your blood, and as you said correctly, there was some lower blood count in your red blood cells. There are some blood cells that are red, and the important function of them is supplying blood with oxygen. Am I making any sense?
Okay. Yeah.
Okay, so we need oxygen to act well and not having any problems like tiredness or some
2
pain
minutes
or
remaining.
something else. But when we have lesser amount of these blood cells that acts as important components to supplying your body with your oxygen, we have some problems we call anemia.
Anemia. Okay. Right. So do I have anemia?
Okay, and one kind of Yeah, but a specific kind that you have is you don't have the disease. You just have a trait. I mean, you just have one faulty gene that is not actually the disease, because your as you said, your sister has the disease. She probably have two faulty genes. That it means having the disease. You are just having one gene. That means a trait, and it shows less symptoms.
Okay, do you mean trait of anemia or trait of what? Thalassemia?
Yeah, thalassemia is kind of anemia that's blood cells, red blood cells are lesser than normal. They're smaller and lesser. As we checked your iron, and it was okay. Your anemia is not that kind related to deficiency in iron, because it can also cause smaller cells and anemia. Okay.
Okay, doctor. All right. So
Move
So
on to the
Mary,
next station.
as
time's up.
we
Time's up. Okay. Thank you, Dr. Atus. Thank you so much for your participation. All right. How do you feel?
short of time,
Okay. All right. What
I
else?
just want to start the genetic pattern, and the time is up.
Okay. All right. And what would you say about your performance in terms of the data gathering, taking the information? Did you miss anything? Did you ask too much questions or no?
Maybe a bit too much, because she said that I don't have any problem.
Okay. Do you think asking about the family support and people who around her is related to the situation here?
No, actually, I just approaching mental disability, or something, the difficulty learning of her, about, but it was mild with her, and I think it was not needed.
Okay.
Begin.
Why do you think that she has learning disability?
Because she just said it was too quick last time, so and there
Yeah.
was some slow speech.
Okay. Well, when I told you I was not paying attention, okay, and they were talking quickly, this doesn't mean that I do have learning disability. Some people are okay, but when people or English people talk, they don't understand. Okay, right? This doesn't mean
Yeah,
that they have learning disability. I'm happy that you went through this, okay, and you've done this mistake, or you understood this like this, so we can talk about that. All right? This is not learning
yeah,
disability. Usually, learning disability cases will come in the question, written in the question, the patient has learning disability. Okay?
yeah.
All right? Okay.
Yes.
In
Thank you.
terms, well, good. In terms of management, you didn't reach the management. You didn't.
Yes.
You were just trying to explain what's going on. Okay. In terms of your interpersonal skills, do you feel like you have any problem? You need any, correction for the performance in terms of your interpersonal skills, or you feel they are okay?
Mm, if it was okay, I didn't do this mistake about learning disability, so I
Yeah.
think there were some problems.
Okay. So I'm happy with your interpersonal skills, Vivian. You have a good eye contact. Your tone of voice is good. You can play with your tone of voice, and you can comment on the patient. You know, when she told you I was not paying attention, you were trying to find out what was the problem, and you said sorry if when they talking quickly, I'm going to talk slowly. It was good point from your side. Okay. My concern is that your understanding of the data gathering, okay, and the way you explained the bloods. Okay.
Yeah.
All right. So what does
Yeah.
that mean? What does that mean? Let's take it one by one from the start of the station till the end. Okay. This patient came in to the clinic, in the Will Woman Clinic. They've done blood tests at the start, and then they've done another test to exclude iron deficiency anemia because the patient has anemia, microcytic hypochromic anemia, right?
Yes.
Okay. All right. Or microcytic anemia. There is nothing about the
Hypochromic.
chrome here. Yeah, it's microcytic anemia. Okay. So microcytic anemia, what are the causes of microcytic anemia? The possible causes.
Low iron
Iron
deficiency,
deficiency anemia.
thalassemia,
Yeah. And
thalassemia,
yeah. And anemia of chronic
and
disease.
may
Anemia of
yeah.
chronic disease. Okay. So these are the most common
Yeah.
causes of microcytic anemia. All right. They've excluded the iron deficiency anemia. So no need to ask about iron at all, about the causes of low iron. She doesn't have low iron. All right. You don't need to ask about. You asked me about bleeding and bruises because you're suspecting thalassemia from the start, or
Yeah.
okay, all right. And chest pain. Why did you ask about chest pain?
Just because of anemia, but it was really mild, and I don't think it causes any chest pain
Yeah.
usually.
Okay. So chest pain is not really wanted here. You can ask about shortness of breath, some tiredness, and that's it. Okay.
Yeah.
And bleeding and bruises. Okay, if you just need to find out what's going on. But if I were you, I'm not going to ask about bleeding and bruises. It's mild anemia. The iron is okay. No need for bleeding and bruises. Okay. You have the test results here. The hemoglobin is low and the iron is normal. All right. In any test results case, we tend to ask the patient, why did they do the test results in the first place? This is the first question. Okay. Then in your present history, you ask about the symptoms and signs of abnormal findings. The symptoms and causes of the abnormal findings. What are the abnormal findings here?
Low hemoglobin and microcytic.
Yes, low hemoglobin and microcytic anemia. What are the symptoms of low hemoglobin? Tiredness, shortness of breath. Okay. What are the possible
Yeah.
causes?
As you said,
Iron,
iron
it's been
deficiency,
excluded.
thalassemia, and
Yeah. Iron, it's been
yeah.
excluded. We are not going to talk about iron at all. All right. Or ask about iron deficiency anemia. Anemia of chronic disease. We can ask, do you have any medical condition? You've asked me this. All right.
Yeah.
In terms of thalassemia, you ask about family history, right?
Family history.
Yes, you
Yeah.
asked me about the family history. All right. So these are the questions in the present history. In this case, that's it. All right. So, do you have any symptoms, shortness of breath or tiredness? Do you have any family history of blood disorders? Do you have any medical conditions? All right.
Yeah. Yes.
Then you can move on to the personal history, which is okay. Diet, exercise, smoking, and alcohol, just to find out her lifestyle. Is it okay or not okay? Just to give her an advice about this. We have a category called 4Ps because the patient is female, right?
Yeah.
You ask
I
about
forgot. Yeah.
pregnancy, partner, and if she's taking pills and these things. What is the important one in 4Ps here?
Pregnancy planning, I think.
Pregnancy, yeah? So you can ask her
Yeah.
about pregnancy here in 4Ps. You asked me, you didn't ask about pregnancy, but you've asked me about who do I live with, and I told you I'm living with my wife. Okay?
Yeah.
So no need to talk about pregnancy or anything else. Okay? She is living with her wife, and then you move on to the concerns. Do you have any concerns about your results, or do you have any questions, any expectations from the consultation? Ideas, concerns, and expectations. Okay. Do you need to examine the patient or to bring her because it's a phone call? You are calling. Do you need to bring the patient to examine her?
No, I don't think so.
No. Okay, you
No.
don't need.
No.
Do you need to do any further investigations?
No, because she don't want to be pregnant. No.
Okay. What about thyroid function tests, maybe? We can. Thyroid and liver and kidney function tests. We can. We can ask her, we can tell her we can do just checking the thyroid function test and liver and kidney function test, just to be in the safe side that you don't have any
Yeah.
chronic disease. Okay. Then you move on to the explanation.
Yeah.
There is a main problem here, Dr. Atusa.
Yeah.
The way you explain things to the patient, all right? You need some organization of thoughts, okay? You need some organization of thoughts. Did you practice before? Did you practice with people before?
Yes, I just tried to make it simple for learning disability. So I forgot about the structure I had. Yeah.
Okay. Let's agree that this is not learning disability. If the patient doesn't
Yes,
pay
yes.
attention to something, this is not learning disability. If they didn't understand English, this doesn't mean that, or they were talking quickly and she didn't pay attention, this doesn't mean that this is learning disability. Okay? So we've agreed on this. Okay. Even if I was having learning disability, I was struggling a bit in understanding the explanation that you've told me. All right. So, what's the problem here in the blood result? It's only one problem. What is it?
Anemia.
Anemia. Okay. You try to
Yeah.
explain to me your red blood cells and oxygen, and we need oxygen, and this is important. And you've told me about anemia very lately. Okay? So
Yeah.
tell me, okay, the blood results are showing that you have anemia.
Mm.
To the point, okay? You have anemia. Do you know what is anemia? Okay. If the patient has learning disability, if she or he told you, no, I don't know what's anemia, what are you going to say? Well, okay, anemia means weak blood. Okay? Weak blood. All right? Simple, to the point. Okay? Then you tell her, all right, you reassure her that you don't have any symptoms, everything is quite reassuring from your history. So this is a good thing, all right? You don't have any symptoms of anemia. But as doctors, when we see anemia, we think about three main causes. The first one, which is iron, and that's why we have done iron level, and it's thankfully normal. You don't have any iron deficiency anemia, all right? The second one, which is anemia of chronic disease, thankfully as well, you don't have any problem, but we can do some bloods to check your thyroid function test and liver and kidney function test just to be in the safe side. Lastly, the last cause, which is thalassaemia, like your sister, okay? But in your case, you don't have symptoms, so you might be a carrier of the trait of thalassaemia. So you are not diseased. Okay? What you've explained to me, you were trying to tell me, I told you, do I have anemia, doctor? Then you told me, yes, but you are having only one trait, or you are having the trait. This means that you don't have the disease. Okay? And you didn't tell me the disease of what? Is it thalassemia or anemia? I do have anemia. Okay, I do have anemia, but I don't have thalassemia. I am a carrier for thalassemia. All right? So you don't have the disease, you are a carrier for the trait, okay? For that, we can do a simple blood test for you, okay, to check if you have the trait or not. Okay, this is what you can do to the patient. Blood test to check if she has the trait or not. If she has the trait, okay, and it's confirmed that she's a carrier, then you can refer her to genetic counseling. Okay? If she has a husband, all right, and she's willing to have pregnancy, you can tell her we offer woman, well, she's 45 in this case, but I'm talking about if she has husband and she's younger than that and she's willing to have pregnancy, tell her in the NHS we offer the simple blood test for you and for your partner as well to check if you have the trait and he has the trait. And then if you have both the trait, we can send you to the genetic counseling, because this disease, if you and your husband has both the trait, your child might have the disease itself. All right. So this is the explanation. Okay, I can tell you the explanation in 1 minute. All right, it doesn't take 1 or 1.5 minutes. You can tell her, okay, Mrs. X, we have done some blood test on your blood. It's a full blood count in the first time. The blood results showing that you have anemia. Okay, do you know what is anemia? Anemia means weak blood. All right. When we see anemia in patients, we tend to think about some causes. The first cause is iron deficiency anemia. That's why we've done in the next time the iron level. Thankfully, it's normal. The second cause is anemia of chronic disease. Thankfully, you don't have any symptoms, any problem at all, but we can be in the safe side. We ask for some function tests in your organs just to be in the safe side, all right? Lastly, what I'm thinking about is thalassemia, as your sister has thalassemia. You don't have symptoms, okay? This doesn't mean this means that you don't have the disease, but you might be a carrier to the disease. You have the trait of thalassemia. Okay. As long as you are not willing to have children in the future, this is not a problem. Okay. But if you are willing to have children in the future, we will be concerned if you can, or if you transmit this disease to your children, especially if your husband has the trait. Okay.
Okay.
All right. So
Yeah.
do you want to know what we can do for you in terms of our help? Yes, please, doctor. Okay. We can send you to the lab again to do a simple blood test to check if you have the trait or not, and your husband as well, okay, to check if you have the trait, and your husband, we can send you to the genetic specialist, all right? Meanwhile, don't be worried at all. You don't have any symptoms. Your lifestyle is very good. So keep doing what you do until you be seen by the specialist or you do the blood tests. All right? Okay?
Yeah. Thank you.
All right. Okay, Dr. Atusa. So my concern in your performance is about your understanding about learning disability, or, just talking quickly on these things. In psychosocial history, you don't need to ask about the help or who is with the patient, supportive or not, and these things, if the patient doesn't have any problem. Okay? Got me? So
Yeah.
don't make it a routine question in any case. Who do you live with who do you live with? Is he supportive or not? Is she supportive or not? Not in every case. Okay? All right?
Yeah.
Do you think that it's helpful in this case? No, right?
Yeah.
So
No,
it's not helpful. Okay, just give me a second.
Okay.
All right. So logic thinking about the data gathering. Think if it's helping you, ask the question. If it's not helping you, don't ask the question. Please have more practice on explaining things in a simple way with organized thoughts. All right? Practice on this, please, okay? All right.
Okay.
Thank you, Dr.
Okay. Thank you so much.
Atosa. Yeah, all the best, darling. All right.
It was really helpful. Thank you.
Thank you. Thank you. All right. Data gathering. I would say 3 in data gathering. Not a major problem. I took one mark because of the irrelevant questions. Management, you didn't reach the management, so sorry to give you 0. All right. Interpersonal skills.
Yeah.
Well, it's good. Your interpersonal is good, but because of the way you've explained things to me, I was a bit confused when you were explaining things. So I would give you 2 or 1 in the interpersonal skills. I'll be harsher, okay? Just to encourage you to practice more, okay? But your interpersonal skills, as interpersonal skills, it's not a problem. The problem is how to explain things to the
Yeah.
patient. Okay?
Explain.
Yes, I will give
Okay.
you a tick in language and management. Language means that your way in explaining things were not clear. Okay? And the management because you didn't reach the management. All right? Okay.
Yeah. Yeah.
All right. Thank
Thank
you,
you
Doctor.
so much.
Thank you, darling. All right. Let's do the next one. Dr. May,
Yes.
ready?
Okay.
All right. What's this question? Okay. All right. Read your question and
Okay, doctor, I think I'm ready to begin.
ready?
Yeah, sure.
Let's see. Mm. Okay. Just
Would you like me to turn on my camera?
yes, if you would like. Yeah.
Okay. Okay, can you see me?
Yes.
Okay.
Okay. I think we have 2 seconds more.
Begin.
Off you go.
Hello, it's Maidia Ali. My GMC number is 8042848. Hello.
Hello.
I'm Mai Ali, one of the doctors here in this clinic. Could I please confirm your name and age?
Yes, I'm Becca Walton and I'm 49 years old.
Okay, and is it fine if I call you Becca?
It's fine, yes.
Nice to meet you. So how can I help you today?
Well, doctor, I'm quite embarrassed about the problem that I have.
Oh, Becca, don't worry about that. I mean, I'm a doctor here and I deal with all kinds of problems, including embarrassing ones. Please feel free. Go ahead. Tell me. How can I help you?
Well, okay. I do have itching
Mhm.
down below.
Okay. Tell me more about it.
I don't know. So I feel irritation and itching in my vagina. I don't know what's that, and it's new for me.
Okay. Could you tell me when did it begin?
Well, it started maybe 1 month ago.
Okay. And could you tell me, like, so far, like, is it like, how often does it happen? Is it like every day? Is it like,
Yeah, it's always there, doctor. It's always there.
oh, okay. And have you tried taking anything to make it better?
No,
No. Okay. Have you noticed anything that makes it worse?
no, nothing specific. No.
Okay. And okay, so like, have you noticed like anything unusual like from your front passage?
Like what, doctor?
Blood. I
No,
mean, there was blood.
no,
Okay. Was there like any discharge?
no.
Um, okay. So, have you like changed? Was there any recent change in your routine, like
No, no,
any new soap, perhaps, or you have used any new soap?
no, no.
Um, okay. Uh, I just wanted to ask you, did this happen before, or is that the first time?
No, it's the first time for me, doctor.
Okay, do you have any medical conditions I should know about?
No, I don't have any medical condition now.
Okay, all right, that's good. And are you allergic to anything at all?
No.
Okay, I just wanted to ask you, are you feeling anything else with this itching?
Well, I feel sometimes that I have my face is hot.
Mm-hmm.
Episodes of hotness in my head in face. I don't know. Yeah.
Okay, and like, are you like feeling unable to sleep at night?
Yes, sometimes. Yeah. Yeah.
Oh, okay. And could you tell me how is your mood, Becca?
My mood is okay. I'm okay now. I don't have any problem in my mood.
Okay, all right, that's good. I'm happy to hear that. So tell me, Becca, could you please walk me through your periods? Like, do you still get your periods or not anymore?
No, no.
Okay, could you tell me like when did you have your last period?
Maybe 1 year ago.
Okay, all right. And you're not on any pill or any.
No, no.
Okay, that's good. Oh, okay, so you've been saying it's been ongoing for 1 month now. So did it impact you in any way?
Um, well, I feel embarrassed when I feel like the itching. I want to itch. And this is
Mhm.
embarrassing me. Yeah,
Understand? Yeah, I can get what you're feeling. Okay.
yeah.
And so far, would you like to share what could be behind that?
Do you know?
You don't know.
Yeah.
Okay. Is there anything particular you're worried about?
Nothing specific now.
All right. Thank you so much, Becca, for answering my questions.
Thank you.
And now I will need to examine you, okay? I'll
Yeah.
need to take your temperature, your blood pressure, your heart rate, and I will also be requesting routine blood tests. I'll need to check your hormonal profile.
Mhm. Okay.
All right. And uh, is it okay if I examine your front passage?
Okay.
All right. Okay. Chaperone will be with us to ensure your privacy. Oh. Thank you for allowing me to examine you, Becca. So from the examination, like when I looked at your front passage, it's quite inflamed. It looks red.
Mhm.
So and from what you've told me, I believe what you have is something called uh, atrophic vaginitis. Have you ever heard of that?
No, doctor, what's that?
Oh, okay, let me explain it to you. So this is when, it happens in a lot of menopausal women. So as a result of a drop in a hormone
2 minutes remaining.
okay. So as a result, the front passage is the vagina becomes dry and the tissue starts to shrink, and this explains why you're itching.
Okay. All right.
Is it clear so far?
Yeah, it's clear, doctor. So do you think that I do have menopause symptoms?
I'm sorry?
You mean that the symptoms that I do I have is menopause?
Yeah. It's a symptom of the menopause itself. Because you have like flushes, you feel that your face is hot, and you feel that sleeping is been troubling you recently. So yeah.
So what should I do now, doctor? What are you
Yeah,
going to do?
sure. So for starters, I will be prescribing you a topical estrogen cream. I will be giving you the directions on how many times to put it each day. Okay.
All right.
Okay, and if you'd like, I can start you on hormonal replacement therapy if you'd like that, since you are complaining of other symptoms like flushes and difficulty sleeping.
Okay.
Okay.
I heard about hormone replacement therapy that it can cause cancer, doctor. Is that right?
Okay, it's good that you've asked this question, because hormone replacement therapy, like any any therapy, especially that involves hormones, it has some risks and benefits. Okay. Yes, I mean, it could be a possibility. But you know, like when you follow the directions, like the doctor is telling you, okay, the benefits would necessarily
Move
outweigh.
on to the next
Okay.
station.
Thank you. Time's up. Thank you, Dr. May.
Thank you.
Good. All right. Did you reach the diagnosis from the present history or where exactly?
No. From how it looks like the vagina.
Okay. All right. How do you feel about that case?
Time management is still a problem for me. I'm a little bit slow.
No, I don't think that you are slow. No, you are talking in a good pace. Okay. So what you wanted to tell me more? What are the things that you wanted to tell and you didn't manage to tell?
Okay, I think the family history, I forgot to ask about any family history of uterine cancers or any vaginal cancer, a cancer of any kind, breast
Yeah.
cancer.
And when I asked you about hormone replacement therapy, right?
Mhm.
Okay. What else?
Safety netting.
Okay.
I think maybe that's it.
Okay. Do you think asking about sexual history might be helpful here in this case?
I don't think so because I mean she said that there's no discharge and yeah, so there was no discharge and there's
Okay.
nothing unusual.
All
Begin.
right. Yeah. Okay. Well, I do agree with you partly in terms of the sexual history here in this case, because she has itching in the productive system. Okay. So, it is worth asking about, are you sexually active or not? Okay. And that's it. Do you use safe practice? And that's it. These two questions and nothing more than this. If you ask, but because it is not related to sexual activity, your data gathering is proper. You didn't. I'm not going to take too much marks. I would take 1 mark and that's it. Okay. But you've asked about everything here in this case. You asked me, can you tell me more since when you have it? Anything that makes it worse, anything that makes it better? You explored the itching. You asked about this discharge and discharge and bleeding. Okay. You can ask me about any skin problem, any problem in the skin, like redness, okay, any swelling, it would be good. All right. Painful micturition. Okay. So these are the things that you missed. All right.
Okay.
Skin redness, swelling, and dysuria. All right. Then you've moved to the past history. If I do have any medical condition, it could be candida, right? Itching could be
Possibility.
candida. So if I have diabetes, I could have candida. I don't have any medical conditions, no medications at all. And then you ask me anything else. Do you have any other symptoms? I was happy with this question, to be honest. If you didn't ask me this question, I'm not sure if you were going in the right direction or not. Okay. So yeah, anything else? And then you can ask me about personal history, smoking and alcohol. Okay. Just to give me an advice, but if you don't, it's okay. My mood, you ask about mood, which is really good. Ideas, concerns, and expectations. And before the psychosocial and ideas, concerns, expectations, I would love if you asked me about sexual history. Okay. And then you examined speculum examination or the front passage. You can ask the patient, provide a chaperone, and then the management. Okay, it is atrophic vaginitis. All right. I would love if you tell me it's a common condition in this age group. Okay. As you mentioned to me that you didn't have your period for 1 year now, this could be related to menopause. Okay, so explain to me first before you telling me it's a symptom of menopause. Did you get my point?
Yeah.
All right, you told me it's atrophic vaginitis, it's a symptom of menopause. Okay, no, it's better to tell me, well, okay, it is atrophic vaginitis, which is thinning of the vagina, all right? And this is common in this age group. And you told me that you didn't get your period for 1 month, for 1 year now. So this is one of the symptoms of menopause or stopping of the period, okay? Don't worry, it is treatable. As I mentioned, it's common. Reassure the patient, and then you can tell me about topical estrogen. If I'm sexually active, you can advise me about lubricants during sex. If you asked me about my sexual history, I would say I'm not sexually active, so you don't need to talk about lubricants. But just in case if she's sexually active, you advise about lubricants. You can talk with her about HRT. Yeah. If she's concerned about cancer, you tell her, well, okay, the benefits outweigh the risk, as you did, okay, but I just need to ask if you have any family history or of cancer or any thing like this, just to be in the safe side. Okay, you can give me some advice about the hot flushes. Sit in a cool room, light clothes. Try to have stress management. Okay. What else? Sleeping. What would you advise me?
Sleep hygiene. Do not use any screens before going to bed.
Yeah.
You
So this is
know,
how to be patient-centered. She has 3 symptoms: vaginal atrophy, and sleeping problem and hot flushes. Give her advice based on these 3, and follow the patient up, and that's it. Give her leaflets, and that's it. So what you missed is the patient's role and giving leaflets and follow the patient up. Okay. All right. If I give you marks, data gathering 3, as I mentioned, what you missed, we have talked about them. I'm not going to dwell. 3 symptoms in the present history and the sexual history. Okay. In the management skills, I will give you 3. Okay. The patient's role is important. Okay. Interpersonal 3 as well. I would love if you just explained about menopause before, telling me that I didn't have my period for 1 year. So 9. Good.
okay.
Good, Dr. May. Good.
Thank you.
Well done.
Thank you.
All right. Okay. Thank you.
Thank you.
All right. Yeah. I'm going to answer your questions, doctor, at the end of the session. Okay, don't worry about your questions or about answering your questions. Okay. Who else we have? Dr. Marina?
Yes, doctor.
You did a station with me in the last session.
Yeah, I did
Breaking
latest
bad
video.
news.
Yeah, that's true.
Yeah. Okay. All right.
Okay.
Yeah. So, all right. Are you happy to switch your camera on?
Oh yes, okay.
Okay.
Can you see me now?
Yes, I can see you. All right. You have this question. Read your question, please.
Begin.
Hello, my name is Marina. My GMC number is 1234. Hello,
Hello, doctor.
my name is Marina. I am one of the junior doctors working here in the GP practice. May I confirm your name and age, please?
I'm David Longfoot, and I'm 55 years old, doctor.
Okay, good to see you today. How do you like to be called today?
David is fine.
Okay, thank you, David. I understand that we are here for follow-up. Am I right?
Yes, yes.
Okay, yeah, that's good. Okay, so I understand that you have diabetes mellitus for quite a long time. Am I right?
Yes, I do have diabetes,
Yeah.
but it's just for 4 years. Yeah.
Okay, yeah, okay. So actually, we have done a blood test for you to assess your the control of your diabetes. Okay, but
Yeah.
firstly, I'd like to ask you a few questions. Then I will answer your concerns. Is that okay
Okay.
with you?
All right.
All right, thank you. So you told me that you have diabetes for 4 years, right?
Yeah.
Okay, and how are you managing with your diabetes so far?
I'm managing well. They
Okay.
advised me on diet control, and I'm
Okay.
following the advice, and I think it's controlled. Yeah.
Right. Okay, that's great. Okay. So, what symptoms did you have that make you have the diagnosis of diabetes in the first place?
It was just, a routine checkup, and I found
Okay.
my blood
Yeah.
sugar
Okay.
is high.
Okay, that's great. Okay. Do you feel that you go to the loo more frequent?
No,
Okay. Do you feel that you are thirsty more thirsty?
no, actually, doctor, what I feel now is that I'm tired all of the time. Yeah,
Okay.
and I'm sleepy as well.
Okay. Okay. So, this tiredness is something new for you, right?
Yes, yes.
Okay, okay, okay. I'm sorry for that. So apart from this tiredness and the sleepiness, do you have any other symptoms at all?
No,
Okay, okay. Have you had any headache at all?
no,
Okay, any weakness, any part of your body?
no,
Any shortness of breath at all?
not really short of breath, but
Mhm.
my wife told me that I'm snoring.
Okay, so think that you're snoring, that's during night, right?
Yes, doctor.
Okay, and do you wake up in the night gasping for air or something like that?
No,
Okay, okay. That's good. Okay. So, have you noticed any infection in your food or something like that?
any?
Infection in your food?
No,
Okay. Okay. Any problem with your eye, with your
no,
vision?
no.
Right. Okay. And you told me that you are just following diet modification for your diabetes, right?
Yeah.
Okay. Do you regularly check your blood sugar daily?
Yes.
Okay. And how it's measured? I mean, what's the
The
number?
measures are the measurements were within the normal limits. So yeah, I think my diabetes is well controlled. Yeah.
All right. Okay. Okay. That's fine. So, what about your lifestyle in general? Do you eat healthy diet?
Yes. Yeah. I'm controlling my diet because of the diabetes. Yeah.
All right. Okay. So, and are you playing any exercise?
Not really. No.
Is there any particular reason for that? You feel busy?
Well, yeah, I'm busy by my work. So yeah,
Okay. Yeah. And what do you do for living?
I'm a taxi driver.
All right. Okay. Okay. I will come to that in a minute. Okay. But firstly, can you tell me, do you smoke?
No, doctor.
Okay. And do you drink alcohol?
No.
All right. Okay. So you told me that you are feeling sleepy most of the time in the morning, right? Does it
Yeah.
ever happen that you slept over the in the morning or have any naps at all in the morning?
Yes, sometimes I want. Yeah, I want to have naps. Yeah.
Okay. Okay. And does it ever happen while you are driving your taxi or something like that?
No.
Okay. Okay. That's great. Okay. So apart from that, is there anything else bothering you?
Nothing. No. Just
Okay. Okay, yeah, okay. So, are you sexually active?
yes.
Okay, any problem or issues with that?
No.
Okay, that's great. Okay, so may I examine you now, then we can continue our discussion. Would that be okay?
Okay.
So, I'd like to check your blood pressure, and I'd like to check your oxygen saturation, your respiratory rate, and your temperature. And I'd like to check your blood glucose level once more as well. Okay.
Mhm. Okay.
Okay, yeah. So,
Examinations are normal.
okay. So, do you have any idea what could be the cause of your symptom?
No, doctor.
Okay, and anything in particular concerning you today, David?
Just
2 minutes
the
remaining.
tiredness and the sleepiness.
Yeah, I
Yeah.
understand. Okay. So, all right. So, from what you are telling me, and as I told you, we did something called BMI, which is a relation between your weight and height. Okay.
Mhm. Mhm.
It is a little bit on the higher side, and it
Mhm.
should be lower than that. Okay.
Okay.
So this might be one of the causes. That's why you are having this tiredness. By
Mhm.
that I mean there is something called obstructive sleep apnea. Okay.
Mm. Okay.
So by
What is
that I
that,
mean,
doctor?
yeah, I'm going to explain to you now. Actually, if someone is a little bit on the higher side, I mean, if it is obesity, so sometimes the muscles of the mouth just relax while you are asleep, causing you this problem while you are sleeping or with your breathing, I mean, okay?
Okay.
So that's why you are snoring at night. And when you wake up in the morning, you are not feeling refreshed and you are having these naps during the morning time. Okay.
Okay. So what are you going to do for me, doctor?
Well, there are certain things that we need to do. Firstly, we refer you to the sleep clinic. Okay.
Mm-hmm.
They will perform more detailed examination for you. And
Mm-hmm.
they'll perform something called sleep study to see if there is something wrong with your sleep itself.
Okay.
And after that, they might, if it is confirmed as a diagnosis, they might give you something called uh, a device causing like help you to prevent these muscles from relaxation. Okay.
Okay. Mm-hmm.
It's important to following a healthy lifestyle and try to lose weight as possible as you can. Okay.
Yeah, but I'm controlling my diet, doctor. So how can I lose weight?
Yeah, yeah, I understand this point. So actually we have done.
Move on to the next station.
Time's up. Thank you. Thank
Thankfully,
you, Dr. Marina. So how do you feel?
Actually, I am very confused. So first of all, I was thinking it is type 2 diabetes case. I was planning to talk about healthy lifestyle, and I was planning to start him on metformin, as the hemoglobin A1C is a little bit on the higher side.
No, it's normal.
45. Okay, so that's, yeah, maybe that's my mistake. Okay.
It should be 48. Okay,
Okay. Okay.
around 48, more than
Yeah.
48, then you can be concerned.
Okay.
Even this patient is not very old, not very young. So
Yeah.
from 48 to 58, it's okay.
Okay, so yeah, that's my fault then. So
Yeah.
I think my data gathering was just haphazards from here and there.
Well, it was good, apart from one question, and I was shocked when you asked me this question. What was
Sexual
the question?
history. Yeah,
Yeah.
I felt that you read something, so yeah. Actually, one time I just read that obstructive sleep apnea might cause a problem with erection or something like
Begin.
that. So yeah,
Okay.
I heard it once, so just
All
it
right.
came to my mind. Yeah, that's it.
Okay.
Mm.
Partly right, and I do agree with you if you are in the real life. Okay.
Yeah. But there
But
is no point
here
of
you
that
have to
here.
be very focused.
Yeah,
Okay.
yeah.
You have
Yeah.
8 minutes to finish. All right.
Yeah.
Even when you talked about giving me CPAP or devices and these things,
Yeah.
it's to be honest, if I were you, I'm not going to talk about them. What
Yeah.
was important to me is
Mhm.
talking about the lifestyle and exercise and referring
Yeah.
the patient to dietitian. Okay.
Yeah. Yeah.
All right.
Yeah. Yeah.
Yeah. So, okay, but good, You've done it really good. Okay, reasonably well. Right.
Thank you.
So yeah, they've given you this information just
Yes.
to help you. Okay.
Okay. Yeah.
All right. The hemoglobin A1C is normal.
Yeah.
And he has well-controlled diabetes. He told you it's well-controlled, and I'm going to the follow-ups and everything is okay. So the main problem is the body mass
Yeah.
index with the symptoms that he has,
Yeah.
sleepiness and tiredness.
Yeah.
I would love if you ask me about the possible causes of tiredness.
Yeah.
The patient has tiredness, so
Yeah.
follow the structure of tiredness. Since when you have this tiredness? You asked me about since when you have this tiredness, I think. No, you told
No,
me.
I don't ask. No.
Yeah, since when
So
you have
yeah. I will ask after you finish. Okay.
yeah, since when you have it, and do you have any weather preferences?
Yeah.
Do you snore? You asked me about shortness of breath. That's why I told you about snoring. If you didn't ask me about why did you ask me about shortness of breath? Is it because anemia?
No, I was taking it towards hemoglobin A1C is elevated, so I'm asking complications of diabetes. That's why I asked weakness, headache. So this information just take my
Yeah.
mind to another place. Yeah.
Yeah. Okay. So ask me about the symptoms of hypothyroidism and the symptoms of obstructive sleep apnea, especially the body mass index is high.
Yeah.
In tiredness, in general, in
Yeah.
any tiredness, you ask about snoring and
Naps in the morning, I think.
thyroid, okay,
Yeah.
and cancer symptoms. These are the symptoms that you ask about in tiredness, okay?
Yeah.
You went through the complication of diabetes, which is not really relevant.
Yeah.
In this case, it is controlled, okay?
Yeah.
So 1 or 2 questions about the complications and it's enough, all right?
Yeah. Okay.
Did that happen before? Any medical conditions, medications, personal history was okay, psychosocial as well, and driving, everything was good, 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 good. What you've missed are the structure of tiredness.
Yes.
You ignored the tiredness, okay, and sexual activity is not important. ENT examination.
Yeah.
Okay, ENT examination. You can ask about thyroid function tests and vitamin D for tiredness.
Okay.
Okay. So this is in the data gathering. Management, it is obstructive sleep apnea. Yeah, good. It's good that I've reached this diagnosis. I'm happy with that. I'm totally happy with it. Okay. You refer me to the sleep clinic, okay, and you give me an advice about lifestyle and driving.
Okay.
All right. It's obstructive sleep apnea case, okay, but it's hidden in this question,
Yeah.
right?
Yeah. Okay.
Okay.
Yeah.
So yeah. Would you like to inform the DVLA or
Yes.
just advise me about stopping driving first?
So I'll advise them to stop driving first until the confirmation of the disease, and we will discuss with the DVLA.
Okay, good. All right. Yeah. And the referral of the for the specialist. If he asks you, is it urgent or when are you going to refer me?
To be honest, I don't know.
Well, it's urgent in this case because the patient is taxi driver. This is it might affect his, you know,
Let's show and
safety, his safety, okay?
Yeah.
So urgent referral to the sleep clinic. All right.
Okay. Thank you, doctor.
Okay, thank you, Dr. Marina. Well done. Well done, to be honest. Well done. Okay,
Thank you.
good, good. Keep it up.
So can I just ask one question?
Yeah.
In the beginning of the case, I said like you have diabetes for quite a long time. I felt the beginning was not good.
Yeah,
So yeah, he's
you
here
assumed.
for yeah, he here for follow up. So for what? I didn't understand this point. I didn't know
Follow
how
up
to
for his
start.
diabetes.
Okay, yeah. So shall I just start it by understand that you are here for follow up? So how are you coping with diabetes? That's it?
Yes, yes.
Okay. Okay.
Yeah.
Thank you, doctor. Thank you.
Thank you, Dr. Marina. Okay, data gathering. I will take 2 marks in the data gathering.
Okay.
Okay, and we have talked about what you've missed, all right?
Yeah, yeah. Okay.
Management skills. Referred me, gave me the diagnosis. You talked about the lifestyle a bit. So I would say 3 in the management
Okay.
and interpersonal skills 3.
Okay. Thank you, doctor.
Okay,
Thank
all
you
right.
so much. Thank you.
A tick in consultation.
Yeah.
You asked some irrelevant questions and you ignored important points. Yeah. Okay.
Thank you, doctor. Thank you
Thank
so
you,
much.
Dr. Marina.
It's really helpful. Thank you.
All right, let's do the last one. If you have any question, doctors, just write in the chat box and we are going to answer or to discuss your questions. The last one is Dr. I can't remember. Let's see. Dr. Marwa.
Doctor, yeah, you've mentioned my name earlier.
Okay. So, ready, Dr. Marwa?
Yeah, I hope so.
Okay. Let's do the last. Okay.
Can you hear me clearly, doctor?
Yes, I can hear you clearly. Yes.
Okay.
If you are happy to switch your camera on, totally
Maybe
okay.
next
If you
time.
don't, It's okay.
Okay, thank you. Thank you.
Yeah. Read your question, please.
Begin.
Start.
Hello, Marwa Abu Salim, GMC number 802529. Hello,
Hello.
I am Dr. Abu Salim. I'm one of the doctors here in the GP surgery. Are you Mrs. Lauren White?
Yes, doctor.
All right. Can you confirm your age for me, please?
It's 60.
Okay. So, is it okay to call you Lauren?
Yes, doctor.
Okay, Lauren. I can see that you are here for a health checkup, and you have done some blood tests. Am I right?
Yes, doctor.
All right. So, can you tell me more about your condition?
Well,
Why did you do the blood test in the first place?
it's just a routine checkup for my health.
Mm-hmm. Okay.
And that's it. I'm not concerned about something, but I do have a problem in my eye, doctor.
Oh, okay.
Yeah.
And can you tell me more about it?
Well, I do have, if you can see,
Mm-hmm.
white ring around my eye. I don't know what's that. I went to the optometrist
Mm-hmm.
because I was having a problem in my vision. Okay.
Okay.
And he told me you need a glass to wear. I wear the glass and my vision is okay now. I don't have any problem in my vision, but I'm concerned
Mm-hmm.
about this
Okay.
thing. Yeah,
So it's only the problem in the vision.
my vision now is okay.
It's now okay. And do you have any other symptom in your eye? Maybe any pain?
Like what, doctor?
Any pain in your eye?
No,
Okay. Is there any discharge?
no,
Any redness at all?
no,
Okay. And do you see like hazy or maybe you find difficulty in seeing at night?
no at all, doctor.
All right. And do you see like zigzag lines or different
No.
shapes? No. Okay, that's great. And what about the other eye? Is it
The other,
normal?
yes, it's the same. I do have the same
Okay.
ring. Yeah.
Okay, okay, I see. So, do you regularly do checkups for your eye?
Yes.
Okay, and when did this problem in your vision started?
It started maybe 6 or 7 months ago.
I see. And can you describe what was exactly the problem?
I just noticed this ring. I don't know what's this, doctor.
Okay, I see. And you've mentioned that he told you to wear a glass.
Yeah.
And since you wear it, the symptoms are better. Am I right?
Yes, I don't have any problem in my vision now. No.
Okay, and the ring is still there since it started.
Yes.
Okay. Can you tell me, do you have any medical condition I should be aware of?
No, doctor.
All right. Do you have this symptom before, or this is the first time?
No, the first time, doctor.
Okay, and did you take any medication, any regular medication?
No.
Any allergies at all?
No.
Okay, that's good. And how about your lifestyle? Do you think you're following a healthy lifestyle?
Yes, I'm following a healthy lifestyle. I eat healthy and walk every day. Yeah.
Okay, that's great. And you have any other complaint?
No, nothing else.
Nothing. Okay, that's great. So, how about your I understand you're 60 now, so you no longer have the period, am I right?
No,
So, are you taking any hormonal replacement
no,
therapy?
no.
No. Okay. All right. So, can you tell me who do you live with?
I'm living with my family.
Okay, and you're managing well?
Yes.
Okay, that's great. Okay, do you have any concerns, Lauren?
No, doctor. I just need to know if this problem affects my vision or not, and I want to know what are the results of the bloods.
All right. Okay, sure. So, and do you have any idea what might be causing this?
This what?
The problem in your eye, the ring that you mentioned?
No,
No. Okay. Do you have any other expectations?
no, doctor.
Okay, that's good. So, if you allow me, I would like to examine your eye right now. I will check your both of your eyes.
Mm-hmm.
As you mentioned that you have this ring, I can see now there is a gray ring around your lens.
Mm-hmm.
I would also check
Examinations
your
are normal.
observations. All right.
2
So,
minutes remaining.
Lauren, from the information that you have given me and from the investigation and from the results of the examination, I'm suspecting that you have something called cataract. Have you heard about this before?
Cataract. No, doctor. What is that?
Well, it's a kind of a condition in the lens of your eye, so it becomes more gray, so you feel that you can't see clearly. Okay, and it actually happens with age, so it's common in your age group.
All right.
Am I making any sense?
Yes, doctor. Yeah.
All
Okay.
right,
What are we going to do now?
and you don't need to worry about this. So it can affect the vision sometimes, and you mentioned that you're wearing your glasses and it's improving. But sometimes, if it's not improving, maybe we can do more steps to manage your condition.
Mhm.
As a last resort, we might need to change the lens. It's a very simple operation. We take off the affected lens and we insert another one.
Mhm.
Is that okay?
Yes, doctor. Yeah.
Okay. Do you have any concern?
No, doctor. No. Can I drive?
Okay. And well, it's advisable not to drive during this period, and unless your condition is settled. As you mentioned, your vision now is not affected. We can recheck your vision as well. So I would prefer to
Move
refer
on to
you.
the next station.
Time's up. Yay.
Okay.
Thank you, Dr. Marwan. All
Thank
right.
you.
How do you feel?
Chaotic, actually. I'm not sure about the diagnosis, and
Right.
even the blood test results. I haven't spoken about it yet, and I was not sure what to say because it was a lipid profile and it was, I suppose, normal.
Okay.
So
All
I
right.
didn't know what to say actually.
Okay, no worries. Okay.
Yeah.
Why
Plus, it's
did
my
you
first time.
say, all right, no worries. Why did you say cataract?
I don't know about the gray ring around the lens. I thought the one thing that
Right.
I saw, yeah,
Yeah.
it just popped in my mind.
Okay. And is cataract seen here or in
It's all
some
over the
lens?
lens.
Not
Yeah,
over, not all over. It's this thing is in the cornea, outside the iris.
yeah.
Okay. The cataract is
Okay.
inside. You see the cataract inside the from the pupil
All right, I see.
inside. Okay. This is not
Okay.
cataract. Cataract is graying of the
Begin.
lens of the eye. All right.
Mm-hmm.
Is
Okay.
this the lens of the eye?
No.
It's outside the iris. It's
Yeah,
the
it's
cornea.
around.
Okay. So it's outside. It's in the cornea. Okay. Well,
Okay.
all right. Have you heard about something called Arcus before?
I don't really remember it, but I think I've heard about it.
Okay. So there's something called Arcus, all right, or corneal Arcus. Sometimes it's called Arcus snellens if it's in the old age, 60 and above. Okay,
Mm-hmm.
60 and above. If the patient is less than 60, we can say it is called juvenile Arcus. Okay, all right.
Okay.
What is the main cause of Arcus?
Problem in the liver, I suppose.
In hyperlipidemia, okay,
Yeah.
in young ages, okay. Usually Arcus is due to accumulation of lipids here in the outer part of the cornea, okay.
Mm-hmm.
With
Okay.
age, it's normal to have this accumulation of lipids. The patients will have normal lipid profile, doesn't have any problem, but it's just because of the age, there is accumulation of the lipids here, all right? The lipid profile is normal and the patient is 60 years old, so we can say it is Arcus snellens, all right?
Okay.
If the lipid profile is high or you don't have the lipid profile, you need to ask for the lipid profile. Got me?
Yes, I see.
If the patient is presenting with this symptom, all right, and you don't have the lipid profile, you need to ask for or to order lipid profile. This patient might have hyperlipidemia, okay? If the patient has hyperlipidemia, so he has this Arcus due to the hyperlipidemia. Okay, so this problem is Arcus, and in this particular case, it is Arcus snellens. All right, it is not related to hyperlipidemia here. In this case, the lipid profile is normal, but the patient is 60, and usually lipid accumulates here with age. So this is Arcus snellens. It doesn't affect the vision at all. It's a common problem in old age, all right? Reassure the patient and tell him your blood, all of the bloods are normal, which is really good. Your lifestyle as well is good. So keep doing what you do. And regarding this is called Arcus snellens, which is, you know, precipitation or accumulation or collection of lipids in this part of the eye or the cornea. It's a benign condition, common in this age group. Don't worry about it. It doesn't affect the vision at all. And please don't be worried. Okay?
Okay,
All
doctor.
right. Yeah.
As in this case, the lipid profile is normal, and the condition is lipid accumulation around the lens. So, what
Not
if the
lens.
patient asks
Not
the
lens.
cornea? I'm
Yeah.
sorry. Yeah.
Yeah. Yeah, no
So,
worries.
what if the
Guys.
patient asks why, as because of my lipid profile is normal, why should I have lipid accumulation around the cornea?
It's a good question. It's a normal process in old age.
Mm-hmm.
Okay?
Okay.
It's common with
All
the
right.
age. There is lipid collection in this, even if the lipid is normal, it's a normal process. Okay?
Okay, I see.
All
Okay.
right?
Thank you.
Okay. Happy, and I'm happy that we've done the case, and I'm happy with the mistake that you've done. So definitely, inshallah, when you have it in your exam, if you have it, you're not going to
I really hope so.
yeah. All right.
Thank you.
But with regards to your data gathering, were good. I cannot say anything about your data gathering. You went with the structure of the eye. You asked about the pain, vision. I think you asked about headache as well, right?
No, I asked
Not
about
headache.
discharge and redness in the eye,
Discharge and
but
redness, yes. Discharge and
yeah,
redness.
not the headache.
Yeah.
Mm-hmm.
Medical conditions, medications. You asked about HRT, which is, it's not relevant, but it's okay to ask about it. Ideas, concerns, and expectations, examination of the eye. Really, really good. Okay. My concern is the management.
The management, yeah.
Yeah.
I always get stuck in the management, doctor. Yeah.
Why is that? Do you practice
I'm
regularly,
not
Dr. Marwa?
sure. Not actually regularly, but yeah. I think
Okay.
I do the data gathering in a good way sometimes, but the management, I think I didn't study much, yeah, at this point.
All right. It could be due to the studying, but I would say the most important thing is practicing. Okay.
Yeah.
You can study the case and just know it by heart. Okay.
Mm-hmm.
But when you do it with your study partner or with any mentor, you don't do it well because you didn't
Yes,
practice on it before. All right.
I agree.
So practicing is really important. All right.
Okay.
Yeah. Okay. So if I would give you marks in that, I get to be honest, you could take 4, but because of the management, they will give you 3. Okay. Management skills.
Okay. 0. Yeah.
Sorry for this. Okay.
No problem.
Yeah. And interpersonal skills. Your interpersonal skills is okay, but also because the management, they're not going to give you high marks in
Okay.
the domains. All right.
All right.
Yeah. Okay.
Yeah, sure.
All right.
Okay.
Thank you, Dr. Marwa. Thank you for your
Thank you.
participation.
Thank you
And
for the
yeah,
chance.
thank you.
Okay. Thank you
All
very
right.
much.
Yeah. Okay. So this was the last station. All right. Let's see your questions. Okay. Did the meeting start? No, I can't hear. Need to ask about obs and gynae history. Uh,
I'm sorry, doctor. I just
yeah,
have a question.
yeah.
In case I didn't know what is the diagnosis, is it better to consult a senior or to refer to the eye clinic maybe? It's better not to give wrong diagnosis rather than asking a
Well,
senior, right?
okay. Well, in this case, if you consult the senior and you don't give me what are your thoughts, you will still take 0 in the diagnosis and the management because you didn't give me an answer for what do I have. Okay.
Okay.
Asking the senior or asking an opinion for the senior is okay, but what is not okay is just asking for the opinion of the senior. You need to
Okay,
give
so
me, you need to give me thoughts. You need to give me some ideas. And you need to give me working ideas, okay? Here in this case, you give me cataract, and cataract is not, this is not the presentation of cataract or the examination or the examination finding of cataract, okay?
mhm.
You can tell me, all right, everything is reassuring. Your vision is okay now, and I can't see anything alarming in your case, which is reassuring me. I would say that you don't have a big problem in your eye, okay? Just keep your good lifestyle and keep the follow-ups with the doctor for a regular checkup. But for now, I'm not concerned about your vision because everything is reassuring, okay? And I would ask my senior as well if he wants to add something or another opinion from him, okay? Give your thoughts.
Okay.
Got
So
me?
yeah. So in case I didn't reach to any diagnosis or any near diagnosis or any differential, I should approach the case this way.
Yes, you should approach the case by telling your thoughts to the patient. If you're concerned,
Mhm.
tell him what are you concerned about, why you are concerned, and why you are going to refer, or what's your thoughts about the problem, and then you add the senior or ask for opinion from the senior. Okay?
Okay. And
Mhm.
is it acceptable not to give any differentials at all? It will take marks, I know, but
They will take marks.
yeah.
But it's based on the case, to be honest. I can't tell you,
Okay.
well, okay, in generally they will give you a mark. No, in this case, if you didn't give me diagnosis and reassured me, it's okay
It's okay.
because
Okay.
it's a
I see.
benign problem. It's not a problem. Okay?
Mhm. All right.
So they can give you marks in this case. All right?
Mhm.
If you did what we've discussed, all right? But in
Okay,
other
I see.
cases, it might not be good.
It depends. All right.
Okay?
Thank you, doctor.
All
Thank
right.
you very
Yeah.
much.
Thank you, Dr. Marwan. I need to ask about obs and gynae history. Is that for which question, Dr. H.A.? Dr. H.A. I'm not sure what's the question that you asked. Dr. Ali, guys, what 4Ps? 4Ps are period, pregnancy, pills brings contraception in general, and pap smear. Pap smear, okay? You don't need to ask them all right? It's based on the case, based on the case, all right? Dr. Nada, I don't remember
Thank
the
you.
fourth one. Yeah, okay. Marina, period, pregnant, okay. G, to pass station, we need a minimum of, there's no minimum. Okay, it's based on the score, or the general performance of the candidates. Sometimes you get low mark, 4 or 5 in a case, and you pass. Okay, if the pass score of a specific station is low, you might take 5 or 4 and pass. Okay, it's not fixed. Yeah. Do we go into every station and confirm our GMC number? Yes. She has a very comforting aura. Dr. Gan, thank you. Inviting, yeah. Pain. Okay, thank you. Thank you. Dr. Ala, in this case, do we have to ask about pain during sex? Yes. If you are asking about the case of atrophic vaginitis, yes. Yes. You ask her about this. How about contraindications of HRT? Dr. Ali, you're asking about contraindication of HRT in general, or you mean, I didn't get what you
Yes.
mean exactly.
In the context of prescribing or making the decision to prescribe HRT, would it be reasonable to ask about, smoking, VTE, cancer, and stuff like that?
Yes, that's what we've discussed in with Dr. May in the management when I told her about I've heard about that it can cause cancer. You can ask now in this point about the risk factors of or contraindication of having HRT. Okay, so or you can tell her we can start you on a medication called HRT, which is hormone replacement therapy, but this hormone replacement therapy has some contraindication and some risks, and I would need to ask you some questions to find if you are going to benefit from it or not.
Thank you. That's very nice.
Got it? Yeah. Okay. Where I can find recorded mocks? In the channel, in the YouTube channel. Well, I'm going to share the links of my groups and the link of my YouTube channel. You can join, subscribe in the YouTube channel. You will find the new mocks will be added to a playlist named mocks. Okay, so there are many playlists in my YouTube channel. Just when you visit the YouTube channel, click on the playlist button, you will find playlist for understanding PLAB 2, playlist for the mocks, and playlist for the practical, another playlist for the skills mastering sessions, which started 1 week ago. All right. And another playlist for what? Teaching gems. Okay. Dr. Ala or Ala? This is the first thing. Can you switch your mic on, please?
Yes, I can. Ala.
Oh, Dr. Ala. Okay.
Yes.
Your question is, what do if it is juvenile Arcus?
Yes.
In
What to do?
juvenile Arcus,
Yeah.
in juvenile Arcus, the patient will be less than 60, okay?
Mhm.
And most probably he or she has hyperlipidemia,
Okay.
okay?
Okay.
If the patient is young age, or even if the patient is old age and he or she is presenting with Arcus without test results, you need to ask for lipid profile.
Okay.
Got it?
Yes, I got it.
Yeah.
Mm.
So any Arcus, either juvenile or senile, if you don't have the test results, please do ask for lipid profile.
Okay.
Yeah. So these are the questions. Anyone has any question before we finish this session? Thank you, Dr. Ali. Thank you, Dr. Nada. All right. Thank you, Dr. Marwa. All right. So, yes. Thank you. Thank you, darling. So, one last thing. In Arcus case, it could come with hyperlipidemia, okay? As a case of hyperlipidemia case, test results with hyperlipidemia, okay? The patient might raise a concern in the middle or at the end or at the first. Doctor, I do have a problem, this problem in my eye, okay? If this is the case, you tell him, okay, it's Arcus. Don't specify, is it juvenile or Snellen's, unless you know the age, okay? If age less than 60, you can say juvenile Arcus and it's related to hyperlipidemia, okay? And the patient is 60, you can say just Arcus and that's it, corneal Arcus, and that's it. This is the name of Arcus, corneal Arcus, all right? Yeah, and that's it, all right? Okay, thank you, doctors, and yeah, all the best, inshallah.